Hello, I'm Paula Farmer. I am the facilitator of Glide's Racial Justice Group, and we are meeting tonight with a fantastic panel lineup about should I trust the vaccine? I want to tell you a little bit about Glide before we get started. Glide is a nationally recognized center for social justice dedicated to fighting systemic injustices, creating pathways out of poverty and crisis, and transforming lives. Through our integrated comprehensive services, advocacy initiatives, and inclusive community, we empower individuals, families, and children to achieve stability and thrive. Glide is on the forefront of addressing some of society's most pressing issues, including poverty, housing, and homelessness, and racial and social justice. As such, our congregational life group, which is called Racial Justice, seeks to educate and liberate the oppressed and marginalized, with an emphasis on BIPOC in order to realize the beloved community that we are called to be. So, with that being said, I'd like to introduce our speakers for today so that they can bring forth a magnificent program that is really about how do we create that justice for those who are vaccine hesitant or considering why they should have the coronavirus vaccine. Today with us, we have Dr. Ayanna Bennett. Dr. Bennett has worked at San Francisco Department of Public Health as a physician, medical director, and executive leader over the last 17 years. Dr. Bennett is a pediatrician trained at UCSF and in the UCB UCSF Joint Medical Program, from which she received her master's degree in public health. In 2004, Dr. Bennett co-founded a nonprofit in San Francisco Bayview Hunters Point neighborhood called the Third Street Youth Center and Clinic. Dr. Bennett led Third Street as its medical director and then executive director for 12 years, while also working as a practicing pediatrician in the East Bay. Most recently, she is the founding director of the Office of Health Equity at SF Department of Public Health, which partners with the San Francisco Office of Racial Equity on to address San Francisco's longstanding health inequities. As director of OHE, Dr. Bennett oversees a team that does anything and everything that serves to advance the equity, all aspects of the department's work. The OHE team produces and implements training events, coaches leadership and staff, supports data development and evaluation, develops and reforms policy, manages multidisciplinary programs, and works to improve community inclusion. In 2020, Dr. Bennett devoted most of her time to the COVID-19 response and development of the San Francisco Department of Public Health Racial Equity Action Plan. We want to welcome you, Dr. Ayanna Bennett. We also have on the panel with us here today, Dr. Marguerite Lightfoot. Dr. Lightfoot is a professor at the University of California, San Francisco School of Medicine, chief for the Division of Prevention Science, and director of the Center for AIDS Prevention Studies, also known as CAPS, and UCSF Prevention Research Center. She received her doctorate in counseling psychology from UCLA. For the last 20 years, she has conducted research focused on improving the health and well-being of adolescents and young adults, as well as the development of effective interventions to reduce acquisition and transmission of HIV among those populations disproportionately burdened by the epidemic. Her domestic and international research has included developing interventions for runaway homeless youth, juvenile justice involved adolescents, youth in medical clinics and settings, youth with a parent living with HIV, and youth living with HIV, among others. She is particularly interested in developing cost-effective interventions that are easily translatable with utility in community settings and utilizes new technologies to engage disenfranchised individuals in health promotion activities. She has also conducted psychotherapy with predominantly African American and Latinx adolescents, adults, and families infected and or affected by HIV. So we want to welcome Dr. Margarita Lightfoot. And we will also hear from Glide's own Bernadette Williams. Bernadette is currently working in the pulmonary practice at UCSF as a patient care supervisor and she works closely with pulmonary patients who have been diagnosed and hospitalized with COVID. Bernadette also works in the community as a COVID vaccine advocate, helping the underserved and ignored populations to get vaccinated. Bernadette knows COVID firsthand because it knocked on her front door. So we'll be hearing her story as well. So without further ado, I would like to turn this over to our panelists so that we can get started. And meanwhile, please note that if you have questions that come up as you're listening or things that you have already heard that you may be questioning, please feel free to put that here in the chat and we will make sure that those get answered along the way. Thank you very much and welcome.
I think I'll get us started. Thank you so much for that wonderful introduction, Paula. I really am very honored to be here today, and I'm looking forward to having a discussion. One of the things I was thinking about is, why do I even do this work? Why am I here? And why do I think this particular issue is important? Recently, someone sent me a YouTube clip of an Saturday Night Live skit. It's not something that I typically watch, so it was a skit around, it was Daniel Kaluuya, who Black actor, and he was playing a game show host. And the game show was he was basically challenging his unvaccinated family members to get vaccinated. And it was like a game show. He was offering $500 if you would get vaccinated, $5,000 if you would get vaccinated. And his family's members were, I don't know if I can trust it. And it was a little humorous, but it also made me think about that being kind of the narrative out there about BIPOC populations, that they're hesitant about getting the vaccine, that in some way that we need to do more work in this population in order to get them vaccinated. And I always bristle a little bit against that, because that kind of puts it on all of us around. We're the problems that people are the reason why we're not getting vaccinated, that somehow it's our fault. And it doesn't really take into account the context in which all of this is happening. And the fact that everyone has very valid questions. When I was talking to my father, my 78-year-old father, about getting vaccinated, he had very reasonable questions. And so it wasn't that he was hesitant. It was that he wanted to know some very basic answers to why he should get it. What is the dangers? What are the things I need to be worried about? Why did it pass through so quick? And so I think those reasonable questions we hope to be able to answer for you all today. And also note, why is it important for BIPOC populations in particular to get the vaccine? And the reality is, when you think about folks who are impacted by COVID-19, BIPOC folks, Black, Indigenous, Latinx, and other people of color are much more likely to contract COVID-19 than white folks, for a number of reasons that have to do with kind of the context and the society that we live in. And so we also know that given that context, the rollout of the COVID vaccine has been inequitable, where there are more white folks being vaccinated in some states than the folks who are most heavily impacted. And so we want to, at least for me, I want to make sure that we're answering the questions that folks have about the vaccine, so that folks can make that decision and make an informed decision about whether or not to get vaccinated and protect themselves from COVID-19. So kind of with that said, thank you all for being here. Please ask as many questions as you have. No question is a dumb question. And I'm going to turn it over to Ayana to really give you the details around the COVID-19 vaccine.
Hi, everyone. I'm Dr. Ayana Bennett. I am going to do exactly that. So Margarita and I share a lot of the same thoughts about this. And what I'm going to do is give you some specifics to go with that context. It will be more than some people want and less than others need. So I'm asking you all to bear with me. There will be slides that have stuff on it that you don't care about. There will be slides that have things on it that still leave you with a question. Ask your questions and allow it to be as expansive as our communities are. People come at it with different perspectives. So there's a little bit of science you may not like, There's a little bit of history, may not be your thing. And just, I wanted everybody to come to it, trying to find what you need, and we'll get everybody what they need to move on. So I'm going to share my slides. Give me just a moment. Oops, excuse me. Sorry about that. Click the. Perry, can you share yours? It won't let me open this one. I don't know why. I don't want to fumble. So the reason we're here, and I will add to the context that Margarita is giving you, is that we want to, we want to be able to, yeah, thank you. That's perfect. To give you as much information as you need, but I'm going to start earlier than the vaccine at context, because I want to double down on the point that Margarita made. Next slide. Keep going. So first, specifically the vaccine hesitancy, I refer to it as historical awareness because there are reasons behind it that Margarita spoke about, specific documented episodes that have happened. They have not been few. They are not that long ago. There are people living who they impacted. So it's a reasonable thing for people to know about and to ask about. This is not the same thing as the bulk of the anti-vax movement, which is powered by not people of color and not poor people, certainly. It tends to be middle-class white women, frankly. And those are people who have a lot of ideas about vaccines as a whole, a lot of ideas about what COVID is or isn't. That is a very different situation. So we are looking at communities that are asking for facts, not telling what they are, and I'm going to try to give you what you might need to decide on. Go forward. So I just like to set the context for COVID because I don't know that we always do, and it's a little bit of a boogeyman. So it's come down to sharing air. Feel free to wipe down your groceries, but for the most part, the people in that picture are what you don't want to do. You don't want to be close, so stay your 6 feet away. You don't want to be confined so that you're using the air and sharing it even more. So do things outside, not in a building. You want it to be not continuous, so you want to keep it brief. You don't want to be uncovered, so you want to filter the air that's coming into your body, and you don't want people to be coughing or singing or yelling or talking or anything that moves the air. Singing can move air all the way across a room, and that is why that's one of the most risky things to have people doing. So those are all common sense things that many of us know and many of us are doing. The problem is those are incredibly hard to maintain. If you work at a grocery store, if you do any number of things, trying to stay away from people, trying not to stay indoors when that's what your job is, trying to be brief when you have to be there for 8 hours. There are all kinds of reasons that particularly people of color, particularly people who are working low-wage jobs, just can't do what they need to do to prevent COVID. And so we've always been looking for a way that is past behavior and is more substantial protection. Go forward. And why are we talking about communities that communities of color in general? And it's because we know from that history that the system does not have clean hands, and that it's affecting some people more than others. So Black, Native American, Latino, if you look, these are the disparity in the deaths. The disparity in cases looks different. The groups are scrambled, but it's very much the same in that it's inequitable. So what do we need to do? This is like, I liken it to food, that you're not sure whether the food is good, but you have to eat. So what you do when you don't know whether something's good, but you need it, like you need your healthcare system and you need this vaccine, is that you test it. Go forward. And so I'm going to give you a little of the context of the history that Margarita referred to. And I'm giving it to you not so you'll know the list of things that people have done wrong, but just so that when I talk about how you can test that system, that it'll make sense. So many people know about Tuskegee. It's a study. There were over 400 men, Black men in Alabama who were enrolled in a study. Initially, they wanted to be helpful, but when there came a cure for their syphilis, they not only didn't give it to them, they prevented them from getting it. They lied to them constantly. And it took decades before they corrected it. So it was a long, long time. People's families were infected. It's a disaster. There's lots of evidence that people who are from Alabama carry that quite a bit, in communities where there are lots of those people have more suspicion about medicine, and they should, right? They have a reason to do that, and other people don't necessarily. So that's a system in which people were being lied to and not having the same information that everybody else had. In the case of HIV, we knew there was a racial disparity by the second year of the epidemic, and yet there were no specific services for the communities that were disparately being affected for decades later. And that means that we were being denied the kind of care that would be fit for our communities. And instead, we're kind of getting the same care as everybody else, or even less. The 1918 flu, I think, is a great example. That is a time in our history where there really wasn't any access for Black and brown people to the system of medicine that's the bulk of the country. And so in that case, Black nurses, Black doctors stepped up and formed their own network. And that was the trusted network people had. And that was the network that brought the assets that are nurses' knowledge, doctors' diagnostic knowledge. So all of those things were provided by the community. And then the last is polio, in which people all know about the polio hospitals, the iron lungs, and all of those things that were in those polio-specific facilities. Those facilities were segregated and did not, actually, they weren't even segregated because there were no Black facilities. There were just the facilities, and they only took white people. Even the one the president of the United States had built in his honor since he had polio, that one was also not open to everyone. So then there was a separate one built on Tuskegee that did allow at least Black people to use it, but it wasn't the same. It didn't have the same equipment. It's that one little one for the whole country. It was a little ridiculous. So not having the same information, not getting it where and how we need it, needing our own people to be delivering it, and then just being lied to. I would go forward. I would say the bulk of what's happened to communities, despite the more exciting and scary cases like Tuskegee, the thing that happens most is that people can't get what they need. I think we all know that really it's denial, not deception, that is our main problem. So we want to test the system for trustworthiness. So ask questions. Do I have equal information to everybody else? This is an incredibly widespread illness. It literally is the entire planet. So there is information everywhere. If you are not trusting your local information, what's the national information? You don't trust your national information, what's the international information? If you believe you're being deceived, you should be able to help yourself prove that you know what the real information is by really looking for it at trusted sources, and they're everywhere. You can decide whether or not you have equal risk. Are you somehow being a test subject? Are you somehow being given a different kind that's riskier? So the vaccines are the same everywhere. There's a mix of them, but people are taking what they can get because the supply is getting better and better every day, but has been a problem. And for all of you who are worried about being a guinea pig, that part is long gone. We're talking about 150 million people who've gotten a vaccine by this point. You're not in the front. You're not anywhere near the front. In fact, you're almost too late. So please don't worry about that part. We have gotten great data on side effects. They are minor. It is not really a question for most of the information that people are worried about. You are well past that point. Do you have equal access? Is there somewhere for you to get it that has good transportation access, that does the vaccine the way you need it, where you need it? Are those things happening? If there's a place for you to get it and it's accessible, then you are being provided it. And do you have equal choices? Can you just say no? Can you, if you want to not take the vaccine or not want to go to some places that are near you, you want to go somewhere else, in this case, you have an equal choice because the system is the same everywhere. So it's being distributed by the same people. The rules are changing on a national level, or at least a state level, at least a local level. So you always are equated with everybody else, and they should be publicly available. They're very public. They're in the paper whenever they change them. So you do have equal choices and you should know what they are. Go forward. Oh no, back one thing. Sorry, go back one. I just want to point out that one of the most prominent NIH, that's the National Institute of Health scientist, is Kizzmekia Corbett, who was born in North Carolina. She's a Black woman in America. So in the case of the 1918 flu, one of the things that the community used was by leaning on their community members who were in medicine. In this case, there are Black people, Latin people, there are people of all stripes through every part of this because it was done all over the world. So there's vaccine development all over the planet. There's people giving out the vaccine from every community. So you will have some way of knowing that this is not done by somebody else to you, it's done with the participation of the community. Go forward. So when can you get vaccinated if that was enough information for you? Everybody is eligible based on a prioritization plan. I'll tell you what it is in a moment. The prioritization plan will go away in a few weeks and it'll just be everybody. But for right now, there is still a little bit for another week or so, another 2 weeks, and then it'll be everyone. So at this point, you just need to know whether or not you're in one of those eligibility groups. And I'll talk about them in a minute. But if you are, then these are the numbers and we'll give them to you again. If you're not eligible yet, you will be very soon. So start signing up and you'll be able to get your appointment much better. Go forward. If you're one of those people who still needs a little bit more information, I'm going to get a little bit scientific for like 2-3 slides. And if that isn't what you need, just wait for me to get back to something else. So there are currently 3 approved vaccines. There's the Pfizer, the Moderna, and Johnson & Johnson's the one that's the last been approved so far. There are others in the pipeline. There are others in other countries. So Russia has one, China has one. There's a different one in Britain. So there are lots of them. They have many similarities, and they, for the most part, have had relatively similar profiles of side effects. So there isn't a better one exactly. Go forward. So the difference between the Pfizer and Moderna and the Johnson & Johnson, I'll talk about in a moment, those two are very similar. They were made in the same way. They have the same technology. And many people are worried about both whether the technology is new and whether it was too fast. And those are both valid questions, but they're questions of people who don't involve themselves in this industry and just don't know because they're easily answered. The technology is not new. It's at least 10 years old. It's been used in other illnesses, and mRNA has been studied for decades. I learned about it, I'm an old doctor. So how they then tested this vaccine, which seemed to develop very quickly, is the second question. If you're trying to make a vaccine about measles, you have to wait quite a long time to get enough information about whether people are at risk or didn't get it, to find people. That did not happen this time. It's the entire planet. They had tens and tens of thousands of people. If you aggregate them all together, it's 100,000 people in the testing. That happened very quickly because it's everywhere. Being able to tell whether somebody was protected doesn't take you 6 months. It doesn't take a year because the chance of them being exposed is constant. It's very fast because this disease is moving very fast. So what happened was really a reflection of the nature of the problem we have, not necessarily any corners that were cut. Although it does help to have literally every country who has any scientific background contributing to the science. That's much faster and much more than we usually have. It's a lab or two. In this case, it was thousands of labs. Go forward. So you've got this little messenger RNA. Don't worry about it. It's a part of your cells that takes the information the DNA tells you to do, like, hey, go make a liver cell, hey, go make some insulin. The DNA never leaves, so it sends this mRNA out to send that message about what's supposed to happen next. In this case, they made an RNA that has a little bit of the coronavirus messenger in it. So it has instructions for how to make one protein that's on the surface of coronavirus called a spike protein. They all use the spike protein. It's worked very well. That cell that gets that RNA. It's just a little thing wrapped in fat. It dissolves very quickly, so it's only there for days at the longest. It's pretty delicate, which is why all this freezing and handling stuff has come up. But it gets in your cell. That cell sees that message, doesn't care whether it came from its own DNA or somewhere else, and it makes that protein. That protein looks like a little bit like a coronavirus. Go forward. And so your body, recognizing that that's not you, makes antibodies to it, and it makes immune cells that will attack it. Once you have the vaccine, I liken it to you are out in the community protecting yourself, you're washing your hands, you're putting on a mask. Your immune system is in your body watching daytime TV. It has no idea that there's anything to worry about. It is not primed, it's not ready, it's not doing anything special, it's just doing its normal job. Unfortunately, that's not good, because when coronavirus comes around to people who don't have immune systems that are ready, we know for a fact that many of them will have a terrible reaction to it. And some of them will even die from how overwhelming the infection is. They won't fight it off. Some people do, but lots and lots of people don't. So what we want is for everyone to get ready. So you're doing your part, your immune system needs to wake up. So the immune system now has gotten the vaccine. It is awake and waiting. Next slide. And so when that coronavirus finally does show up, it comes to an immune system that has been waiting to kill it. And that is why people who've gotten a vaccine don't get coronavirus. It's not because the vaccine's around doing anything. Vaccines last for moments. It's because it has primed your immune system to do its job. The same job it would have done when coronavirus came, but faster, more aggressively, and probably in greater numbers. Go forward. Sorry, there's a lot of science, but some people really want to know. The Johnson & Johnson vaccine was developed a little differently, but it is really very similar. It uses a little strand of DNA instead of RNA, but it makes the same spike protein or same piece of it, and it works the same way. All vaccines really work that way for the most part. So I wouldn't worry about the differences. The main difference is those other two require 2 shots. There are 2 that need 2 shots and 1 that needs 1 shot. The Johnson & Johnson is the 1-shot version. That's the newer one. And it doesn't have to be frozen in the same way. And so it's a little easier to use also. Go forward. So if you get to be one of those people who's been vaccinated because you decide after today, or you already have, what can you do? It is a fabulous vaccinated life. I can attest to it. You can travel in the US without testing or quarantining. What happens if you try to leave the country is dependent on that country. You don't need to quarantine or get tested if you're exposed. If someone at your job gets COVID, you don't have to do anything in particular, except show them your sympathy. Visit to people who are vaccinated indoors without masks is fine, right? You're both safe. Visiting unvaccinated people is a little bit not as safe, or at least we're not entirely sure, because it's possible that people have an immune system that's killing coronavirus enough not to make them sick, but maybe it's leaving a few in their nose or somewhere that they can spread it. So you don't want to be with unvaccinated people in large numbers, but you can visit with unvaccinated people, a small number indoors without mask or physical distancing. Just don't make that person an elderly person or somebody with cancer or somebody who's at really great risk. You do want to still be careful. Go forward. And so that means that because there's that little risk that we're not sure of yet, you just take precautions in public still. You wear your well-fitted mask, you physically distance, you practice those preventive measures when you're visiting unvaccinated people of multiple households or people at high risk, and you avoid in-person gatherings. It will not be safe yet to get in together in big groups, and also don't participate and encourage people to do that. So small groups, try to stay in one household, but you can go indoors and you can travel and go other places. Limit it, but be reasonable. And I just want to say that people who are concerned because the recommendations change, we take away precautions that we know are working when we know it's safe to do so, not when we hope it is safe. So there are lots of people who are hopeful that the variants, the different mutations of coronavirus won't be a problem. There are people who are hopeful that once they're vaccinated, they can't carry it. None of those people know that for sure. And so while that is their hope, we have not changed the rules for what we want people to do. Go forward. Nearly everyone's eligible at this point. So healthcare workers, long-term care residents, so that's our nursing homes, anyone 65 and older, people who are in some of the frontline positions, emergency services, people working in food, people who are teachers or childcare. All of those folks have already been eligible. We've had about 3 weeks of eligibility for people with health conditions or disabilities, or who are in congregate packed settings. So if you live with 50 people in a facility, a prison, or a homeless shelter, you are a much greater risk of causing a big outbreak. And so we're vaccinating those people too. That's a lot of people. 150 million Americans have gotten at least one shot. So that's a lot of people. We apparently have a lot of different classifications, but that's not everybody. We think about April 15th, the president wants it to now be April 19th at the latest. We'll just open it up to everybody. And that means that whoever you are, if you're over the age of 16, you can get the Pfizer vaccine. The others start at 18. Several of them are testing as young as 12. And so we should be able to start giving it to junior high and high school kids sometime in the near future. But that's all of the adults. So if you're an adult, it's time for you to decide because your turn is coming up pretty soon. Go forward. The way it's happening in San Francisco, we have about the capacity to do 10,000 vaccines a day. I actually think that with some of the improvements in pharmacy and some of the high volume sites, we're really up to about, I think it's 15 or 16,000 vaccines a day. It's an incredible number. No one has ever done anything like this, certainly not in San Francisco. So 10,000 people every day is an incredible number. That's why there are tons of different places to get it, because none of those people can give, 5,000 in one site. So what you have are high volume vaccination sites, and you have community vaccination sites, and then you have pharmacies. The high volume sites are run by different people. UCSF has one. We're cooperating in them. So there are a few of those. There's the high volume site that the federal government runs in Oakland. That site, in fact, does do 6,000 vaccines a day. So somebody can do that number. And then the community sites are mostly run by the Health Network, which is the San Francisco's public clinics, and some of the other community clinics like Haight-Ashbury and those kind of clinics. So neighborhood sites are the ones that we pop up in different neighborhoods. So we have sites that are not clinics or not big car sites, but then are sites that people can walk up to that are in neighborhoods. And then we have mobile units that are moving from place to place, trying to serve lots of communities. The pharmacies are supplied directly from the government. Walgreens, Rite Aid, CVS, Safeway. I don't know if we have Rite Aid here, but we have all of those places. So you can look online for who's got vaccine available and sign up there as well. Go forward. I didn't mention there that the federal government does the VA. It does Indian Health Service, and those aren't ones that are really something that's relevant to most people in an audience, but those are two places that are also giving the vaccine. So this is a lot on this slide, and I'm hoping that we'll maybe be able to put it up at the end, but you can look up all of this on the sites that we give you. The high volume sites at City College, at Moscone, at the SF Market, the Oakland Coliseum's the federal one. There are high volume sites from the different providers. UCSF has several. The network has a couple of the clinics. So Ocean Park, Maxine Hall, Southeast, Chinatown, Curry Senior Center are all giving vaccine, and at the hospital. And the community clinics, multiple community clinics, those spread all over the city in terms of geography. The neighborhood sites we have concentrated in places where we know the population has had a disproportionate amount of COVID. So there are hotspots for COVID in some communities, the Mission, Bayview, and there are parts of those communities. So it's not everybody, it's some corners, some blocks have been really frequent in terms of people getting COVID. So that's where those are. They're going to open Excelsior and Biz Valley in the near future. Mobile units are going everywhere, but they're trying to get homebound adults. So not every senior can get out. They're trying to get people experiencing homelessness who aren't in shelters. Senior living facilities that aren't nursing homes, but are still congregate, still have lots of people. All of those different ways in which people have risk that's not really accounted for. And then the last is the pharmacies, and you can see which one's there. Go forward. So we're trying to expand and expand how you can get the vaccine. So there are more appointments in the last 2 weeks, or there'll be more appointments every week or two as more things come online. So if you couldn't find an appointment, look again. There will be a lot of demand when it opens up to the whole community. So if you are in a place where you want to do it now, please do start to sign up if you're eligible right now. Open access, so the neighborhood sites, the clinic sites are walk up. Lots of them, some of them have appointments, but lots of them have drop-in options. They have ambassadors who are helping people in line. You will be able to get it at one of those sites if you go there. Mobile, on-site, frequently visited areas. So they have points where they go to, but they are trying to cover the high points in the city. Apart from all of those are your provider. So if you have insurance or someone you've been seeing, that system is meant to vaccinate you. The bulk of the vaccine is gone to private providers so that there can be lots of people giving it. So if you have a doctor at Kaiser, Kaiser has your vaccine. You don't have to get it there. There are other sites if they're backed up and you really are anxious, but they do have vaccine as the supply comes in. When they don't have supply, the rest of us probably don't either. Go forward. So if you can do on your screen that code, feel free, but your doctor's office, look to the city websites, which will show we have the capacity to do 17,000. So it's going to get to that point. We don't get 17,000 a day to give out yet. So it will get more and more available as time goes by and we get supply. Supply is getting better and better every day. Go forward. If you are having trouble, especially if you're elderly or have a disability, then we have a number for you to do it by phone for people to help you schedule an appointment. There are also lots of groups that are helping people schedule appointments. So if you have someone in your life who can help you find one of those or call for you or set it up, please do accept that help because there are many, many ways for people to sign up. Don't just use one. Go forward. And then there are lots of websites that have all this information, so you don't have to memorize this. sf.gov vaccine notify will notify you about eligibility based on what you tell them about yourself. Get vaccinated will tell you about where vaccines being given. So the vaccine site listings are on there. Partner websites have links, so the pharmacies and whatnot. And then it'll give you resources about the vaccine or other things you may still have questions about. Go forward. And so here's some websites that are really central, write them down. The California site, the My Turn from California are both statewide ways to sign up and get informed. And then the other is the San Francisco specific one. All right, thank you. And we'll be answering questions after. Oh, I finished exactly on time.
Thank you. That was very informative, and I especially love the history about where vaccine hesitancy and denial of those types of things have come into play. So we appreciate that. We're going to open the floor up now for questions. So you can type them in. We see some really good questions coming in. And while we're waiting on that to happen, I want to invite Bernadette to come on so that she can tell us a little bit about her her journey and deciding, even as a healthcare worker, whether or not she planned to take the vaccine. So, Bernadette. And I love Bernadette because she always tells it like it is. So you can believe anything she's saying.
Hello, everyone. All righty. So COVID, let me tell you my story. COVID came knocking on my door. My partner got COVID. He's a correctional facility officer. So it literally came knocking on my door. But when the pandemic hit, of course, the Tuskegee and other different issues that Black people have experienced, that, that's their main topic. You know what they did to us in Tuskegee, and then hold on, do your research, make sure you do the comparison correctly. So I get it. And this slide was very informative. what I did, I went and found every brown and black doctor that I know, that I work with, and said, what's your thoughts on this? Are you getting it? And would you encourage your mother to get it? And they were all yes, yes, yes. And so what I did was, soon as I got the opportunity, I work in the pulmonary department. So I was one of the first groups that was able to get it, signed up for it. It was no different than taking my daughter to the doctor to get her vaccines. That's kind of how I thought about it. I know research had been going on. And so, when I started sharing my story, of course, people that I knew, did you get sick? How'd you feel? And should I get it? Yes, yes, yes. I got a sore arm. I felt sick. Should you get it? Absolutely. And currently now what I do is, I know people don't have access to computers, elderly people who don't have access to sitting on phones long times. Or I've talked to my own patients and said, hey, I've been on the phone with everywhere and I can't get anyone to help me. Can you help me? So I go out in the community and I help people. You want to get COVID shot? Do you fit the requirements? Okay, let me do some work. I'm out in Oakland. We call it the Underground Railroad for COVID. We're helping people get their shots. If you want it, I'm not going to argue with you. You don't want it? That's fine. Stay away from me. There's, it's not just affecting you. So I'm encouraging everyone, not just people of color. I'm encouraging my own family members, my community members, my neighbors, my church members, whoever, get it, because it doesn't, it's moving, it's going away slowly, but it's here, and COVID is real, as much as, our folks, well, they did this to us and they did that to us. Yeah, they did, it's a lot of things going on, but COVID's real and COVID kills. So I've helped quite a few of Glide members. If you need help, if you're having trouble, you don't know where to sign up, shoot me an email. If I'm on Facebook, call me, text me, I'll help you. That's my story and I'm sticking to it.
Thank you, Bernadette, for sharing that personal journey. So we're going to start with the questions, and I'm going to invite Dr. Margarita and Dr. Ayana back. And I myself am going to get my second shot tomorrow. So wish me luck with that. And I too had thought about not getting the vaccine. I don't typically take the flu vaccine because I work in a school setting and we seem to always have a different strain than what we're vaccinating for. So I totally get it. However, I felt it very important to take this vaccine because of the detriment that it's had on our population. One of the questions that the chat has offered is, could I, between vaccines, catch COVID? And then also on that same note, once I get the vaccine, will I need to have an annual shot and or a booster?
Yes, you can. So people have caught the vaccine in the week after they got their vaccination. Caught the virus,
COVID,
because it takes time for that immune reaction that you're looking for to happen. The body doesn't move that fast. It moves, but it takes a couple weeks. So if you get exposed to COVID, hopefully not because you decided you were safe and went running out in the community all over the place, but just unlucky, you can get it. Whether or not it will be the same as if you hadn't, people do get some level of protection within not that long from the first shot. So we know there's something, but it's not enough. So wait the 2 weeks until after your second shot, and then you can consider yourself vaccinated and follow those rules that you were given. Whether you'll need a booster or not, we don't know. So lots of things are being studied right now. So those 150 million people, lots and lots of them have been asked to tell us about their side effects, tell us whether they got COVID later, and we shall see. We know it's at least 3 months because that was the original study length. it looks like they're
Six months.
people are thinking at least 6 months now. And so the thinking as every month goes by, we will extend that. So we are not a year from the development of the vaccine. So nobody can tell you it's a year. So I don't know if you'll need a booster in a year or a booster in the fall. It does show the ability to mutate. So like we do with flu, when it changes every year, we have to change the vaccine to match it. Sometimes we just put lots of different versions of the vaccine in one shot. That may be what we do this time. We shall see. But right now is when the virus is really widespread. When it takes you days to find someone with COVID, because it's not very common anymore, we'll talk about boosters. But right now, even if it only lasted a couple of months, that would be worth it because it's everywhere. And your risk is the highest right now.
And can you explain the difference between getting an annual shot versus getting a booster?
So the annual shot is a different shot than the, it's been reformulated to fit whatever the changes in the flu virus has been. That's the one that most people are used to getting annually. So the flu virus this year is not the same as the one last year. So that vaccine won't work anymore. Sometimes it's not very different, but sometimes it's quite different. We don't know whether you'll need a new vaccine to account for all the variants. They're just putting the testing for the anti-variant vaccines in right now. So it may be that just the shot in 6 months is a little different than the shot now. It may not be a second one. But we don't know. You may in fact need a booster. The immunity to this is something we don't know. People may get, who had just COVID, may in fact get reinfected. It has happened sometimes. It's not very common, but we do know there are recorded cases. So it's something people are thinking about. It may wane and you may need the exact same shot to boost you again, just the way you do with tetanus or measles. We don't know yet.
Okay.
But we need the amount of COVID in the community to go down. So as many people get it, there'll be less of it around and your risk will be less.
On one of your slides, you had a list of the people who had been fast-tracked through the line who had different medical conditions. One of the things that we're hearing out in the community is from people who have medical conditions who are hesitant because they feel like that might affect them negatively. So how does it affect you if you have an immunosuppressive issue, or if like you're on say high blood pressure medicine?
Mm-hmm.
And what are the chances, like what are the percentages that they're showing of people being allergic to it if you already have allergies to other vaccines?
So the number of people allergic doesn't seem to be bigger. And in fact, it might even be a little smaller than our other vaccines. So if that is something that you are concerned about because you have an allergy, not to anything, but to vaccines in the past, it is something I would discuss with your doctor. The reason you have to hang out for 15 boring minutes afterwards is so that if you have an allergic reaction, they can treat it. Even severe allergic reactions are treatable. People suffer from them and have bad outcomes, not because it's not treatable, but because they had their allergic reaction in a football field or somewhere where nobody could help them. This will not be that. You'll be sitting around waiting for them to treat you if they need to. If you get through that and you don't have an immediate reaction, chances are you probably won't have a severe reaction, and so you're allowed to go home. So I wouldn't worry about that as much because COVID isn't really that treatable and the allergy really, really is. They have tested the vaccine in that many people partly, well, it was partly to get different ethnicities and races and different kinds of people and women and men, but the other was to get different conditions. So some people with those conditions have had vaccine of one kind or another across all of those studies. Whether or not they've got somebody with every illness there is, I don't know, but they certainly had immunosuppressed people. They certainly had people with cardiovascular disease. So we'll see how that works out, but it's the same as every other vaccine. We did not necessarily test measles vaccine in everybody with sickle cell in order to get sickle cell people to take it. We didn't test it against every cancer in order to tell people with cancer to get it. The way the vaccine works of just poking your immune system is not something that we think is going to interact with many illnesses. That virus is very dangerous to all those people. And the vaccine we don't have any reason to think that it is. We're still watching, and there are some questions about how to look for that, but I wouldn't worry about it unduly. And I would ask your personal doctor about what you two think your risk is.
So I don't know if this may be a question for Dr. Lightfoot. As far as the research that's being done out there while this is going on, it's sort of like we're walking and chewing bubblegum at the same time. What research is happening right now, whether that be with the World Health Organization or with local doctors and physicians, around the long-term effects of having taken the vaccine?
Yeah, there's actually quite a bit of research happening on that now, where they're trying to follow folks who've gotten COVID and still have lasting health implications. So whether that's problems with their heart or problems with energy and feeling tired all the time. We don't know a lot about it right now, but we're definitely there's a number of research studies happening right now to get a sense of why it's happening to some people versus not other people. How long do we think it's going to last? Is there anything that we can do about it? Any treatments that are working? Right now, it's a lot of attention has been, let's just try to prevent folks from getting COVID. And so now we're now having more space to be able to think about some of these other things. And so some of that research is now occurring.
I will just add to that, that the idea of long-term side effects from the vaccine itself is unlikely. We give lots and lots of vaccines and they don't have long-term effects. The viruses that they are fighting against, many of them have long-term effects. Polio, measles, chickenpox, they all have effects well into your later decades if you get the actual illness. The vaccine prevents that. It doesn't actually cause anything. Right. So I think there's no reason to think the case would be different here. In fact, these vaccines are a little even more delicate and not sticking around than the ones we already have. But the idea of the long haul COVID, I think, is something people really need to pay attention to. It's one thing to say it's fine for me to be sick for 2 weeks and you're sure you're not going to go to the hospital. Still having ringing in your ears or headaches or dizziness or exhaustion 6 months after you get it, that is no joke. You have become a disabled person. And that is not what anybody is thinking is going to happen to them, but you don't know, and it's not that uncommon, especially not if we're talking in a number of weeks. The people who've been almost a year, those are rare, but weeks, months, that's not that uncommon. So be careful about how you're assessing what the disease is and what the risk is. It's potentially very bad, and it's not just death. A lot of those people who survived and got COVID are not listed as deaths, but they are miserable and they have long-term effects, and they may have heart problems that follow them for decades or show up decades from now. So it's a very bad disease. It affects the whole body. It's in all the blood. It's just a very bad disease. It is not just getting pneumonia and ending up on a ventilator. It's all the organs, your skin, it's everywhere.
So that kind of brings me to this next question, which is you talk about the folks who did not die of COVID, but then there is also the mistrust that is out there around people being reported as COVID death when they maybe came to the hospital with a different situation, or just being lumped in there because they died during the time of COVID. How are you addressing those myths and conspiracy theories?
That one's so wild to me that I find that one so utterly ridiculous. And I'll tell you why. It's like saying that people got marked as traffic deaths when really they had a heart attack in the car after. There's no way the COVID helped you with whatever it was you had. So if you had COVID and cancer, maybe the cancer made your COVID worse, the COVID made your cancer worse, but I would say the COVID was a factor in your death. It's just too bad for it not to have been. And even if it wasn't, that's not going to be that many people. So the idea that we want the number to be higher, I think is, I don't know where that comes from exactly. That conspiracy is too complicated for me, but If you have COVID and another condition, that's the reason we're telling you to get that vaccine, because they interact very badly. So if you don't have a great immune system, if you already have heart disease, this disease that attacks your heart is not good. If you already have lung disease, so people having other conditions doesn't have anything to do with whether they died from, it doesn't make them not have died from COVID. It makes it more likely they died from COVID, because COVID does not like all those conditions, and it makes someone who has a problem have a much worse problem, and then they die. So the idea that the COVID is somehow a separate thing and the illnesses are some, it's the same thing. They interact quite strongly.
Right. So then, on that same track, what has been your response to the folks who are talking about COVID and 5G and nanochips and all of that being injected through the vaccine?
I'm going to let Bernadette and Margarita do that one, because I don't do crazy. Go ahead. I don't have the imagination for it. I really don't. I understand where people get it, but I don't have it. So go ahead, Bernadette.
I tell people, do your research. There's parts of my crazy that recognizes they're crazy, and I didn't want to turn that part of me on. I mean, my Glide family knows. So I just tell people, do your research, ask, if I would know Dr. Lightfoot and Dr. Bennett, they would have been on my, should I get this COVID question? Ask people who look like you that are in the trenches doing the work. That's, the 5G stuff, it's so bizarre to me. I don't argue with those folk. I just say, okay, you don't want to get it, that's fine. And I move along because I know I can reach someone else. So my crazy isn't going to reach their crazy at the moment. All right, Dr. Lightfoot, it's on you.
I'm very similar, Bernadette. I think some people are not going to be convinced. And so those are the folks that I don't spend a lot of energy trying to convince. They've watched some person on YouTube and they've chosen to believe that for whatever reason over all of the science. And as Bernadette said, all of, I think there are some people who are hearing some of that and they have valid questions like, oh, I heard this happened. Like, is this true? And those are the folks that I'm like, yes, let's talk about that. Let's talk about why that's not true. Let's talk about maybe where that came from, but why that's that, what studies have been shown that that's not true. I think 5G is new. And so of course it's causing all kinds of things because it's new. We don't understand it. And anytime there's something new, I think it's human nature for oftentimes some folks to go, this is happening and this is happening. They somehow must be related. And whether or not that makes sense or not, we're human and we kind of try to make sense of a world that doesn't often make sense. And so I think that's partially what's happening.
And I feel like there's so much distrust out there. So there's the distrust of the federal government, there's the distrust of the medical community,
Absolutely.
and then there's also the distrust of the press and news sources. And there is a question here that says, where can we find up-to-date info on research as it happens? That is 100% true. And then how do I know that the things I've read in the news have been fact-checked and are indeed correct?
Most news stories will tell you where they got that information. So it may not be linked, but they'll mention where the research was from. So go looking for the original article if that's what you want. The CDC site usually has the articles that the conclusion came from at the bottom of it. Most things that are trying to show you that they are fact will have references in them, or they'll have references to the reference. So look for those. And if you want to follow the trail back to the original research, you should be able to do that. There's a lot of research though. So this has supplanted every other topic that everybody was interested in. So many, many labs have been turned to this and many, many studies are happening. So there's just a lot to absorb. So know what you're trying to ask about in particular. And I would try to narrow it a little bit so you don't get overwhelmed by 50 different articles, because there are researchers in dozens of countries working on this same topic. And we do share that information across borders.
And where
Yeah,
does
I
it,
would, so
where-
just to add to that, so like part of that question really is, what are the trusted sources? Where can I go? Maybe I don't want to read the whole article, but like, whose voice can I trust? And so as Ayana said, I think going to the CDC website is definitely a good place where you can get trusted information. I work at the University of California, San Francisco, so UCSF. That website there's a coronavirus.ucsf.edu website that has a lot of kind of summaries of the research that's happening, because a lot of that research is happening from researchers at UCSF. I would say that that's a trusted website. Ayana put up the website for the San Francisco Health Department, sf.gov. I think that's going to be a really trusted website, because they basically take all of the information and try to distill it down into some bullet points that most people can understand.
I will say, I should have mentioned the San Francisco Department of Public Health site. And I was incident commander for months and months and way too long, like 7 months or maybe 5. No, it was 7. And that, so I know that we have a research meeting twice a week, sometimes more, sometimes less. And any new research that comes out gets debated by all the epidemiologists, the health director, the health officer. So people are looking up counter arguments. We have the epidemiologists doing it, some statistics people. So things get looked at pretty thoroughly before they end up on that website telling you about a new risk. So there are health alerts, and those are all on the website, and then health guidance. And both of those are written by a whole cadre of doctors who've all volunteered to do this, or they already work for the health department, and people have just been researching and writing now for a year. So there's a lot of digested factual stuff that's on our city website, that's on the websites of other different communities around here. If you're not San Francisco, Oakland's doing the same thing. So this has got the full attention of really huge parts of the health community. So there's information everywhere, and it is being looked at very thoroughly because we're still learning it. So nobody's just kind of going along, because things are changing. So you have to keep up with it, and they are. So UCSF, the city, there are places, Stanford, everyone is doing the same digestion. So you should have a lot of places that you can go to. Go to the city one. There'll be links in there to go to other things if you need to.
and as far as that research, we heard today, or I did, at least on the news, that they are, and I think you also alluded to this, that with some vaccines, they are vaccinating as young as 16. And then I think the hope was that by the summer, they can start to look at junior high and going younger and younger. Somebody just mentioned in the chat that they have a 6-week-old baby. And I know there's also been some research whether or not babies are getting immunity from their own parents. What do you know about that particular situation? If there is a study that's planning on studying babies that young? And
I
also,
don't think they're going to get to immunizing babies that young for quite some time, because risk goes down as the age goes down. It doesn't go to 0, but it does go down quite a bit. The variants are a little bit different. And so we're still waiting to see if all of that is still true, and it's questionable, it might not be. So when you're looking at pregnant women, there are 2 things. Do the antibodies from the vaccine pass through the placenta the way many antibodies do to the baby while you're pregnant? And they do seem to. Do they pass to the baby when you're breastfeeding? I think there's that one's always a little bit difficult to say. They don't get absorbed and circulate in the baby's system, but they can do some prevention. I don't know. That one, I don't know that we've come to a conclusion, but I have not been up on that particular piece. But we do have many people in our OB department and some epidemiologists who specialize in this in the department and at UCSF who are looking at this very closely. So they will let you know as the research gets completed, but the vaccine, I wouldn't expect to go down to that age. It's really about vaccinating the parents. Most kids are getting it from their adults in their life, not from the other kids, at least most of the time. So vaccinating the adults around a child is your protection. And that's the same thing we do for flu and lots of other things. Little babies don't get vaccinated from many things that are risky. And so we vaccinate all of their circle. And that's what I would do. Be careful that the people who are near your very small baby are vaccinated if you can.
And then I think therein lies a little bit also of the confusion that I hear out in the school world is that kids aren't typically getting it from other children. However, we have seen there be outbreaks in schools that are wide open that maybe didn't take certain precaution or enforce mask mandates. So how is someone who is vaccine hesitant, how should they be processing that information, and would that research about the kids be on these websites that you offered?
There should be some on the school-based recommendations that were made. When we wrote the guidelines for the schools, it was based on a lot of research that had already been done. When they say there isn't a lot of transmission, there is less, but going down to where we need it to be, which is almost never, that requires that you follow the precautions. So we're talking about transmission between people who are masked with seats far away from each other. It is not you can't count on that for 10 kids wrestling in the park. So we're talking about controlled conditions in a school where kids are relatively safe and separated and masked. So if you have all of those things, it does seem as if risk is lower in schools than we had expected or feared.
And Bernadette, I wonder if you could speak to one of the questions is, I need to be available to my family. I can't be down. And that is some of the reporting that we're getting for some people after that second shot. Could you talk a little bit about your journey and how it felt, getting the first one and then the second one? And then also if either of you doctors could also address what that downtime might look like for a patient.
I got the Pfizer shot, the first shot. I didn't have much of any issue until day 3. From day 3 to 5, I could barely lift my arm. I did everything but ice it. Called my doctor. I think it's working. I did everything but ice it. I rubbed all kind of Bengay. I went and I did all kind of stuff, but I didn't ice it. And that was probably what I should have done. I mean, I was texting all my pulmonary colleagues like, hey, they're like, just ice it. I'm like, I get cold, so I don't like putting ice on me, but I didn't listen. And the second shot went fine. No problems at all.
I got knocked on my behind.
For 2 days,
I got knocked on my behind that second shot.
For 2 days I was down, but
Yeah.
I worked from home and I made it work. So I mean, it doesn't take you completely out, but I'm fairly healthy.
I watched a lot of TV in a day where I barely got up, and my 9-year-old ran the house. But I will say that people who are down from having COVID are down for a week, are down for months. And each time they never get out of bed for 4 days, not I hung around and watched TV for 8 hours. So I would always compare whatever you're afraid of to the thing that you're trying to prevent, because your choice is not between the vaccine, being down for a day, and being fine and living your normal life. Your choice is between being down for a day and potentially being down for a week or a month or longer. So most people can manage a day. Try to get your shot on a Friday or whenever you can try to manage around that. Very few people who need their jobs can just not show up for 2 weeks because they can't manage it, or a month, or then you're just out and you're disabled. So think about what you're risking, and it is not a day.
Yeah. And I had no side effects. I just had a sore arm that I could still lift, so it wasn't a problem. And so unfortunately, we don't know why some people have these side effects and why people don't. But as Ayana said, that it's really thinking about, like, how can I manage? So if I think I might be down for a day or two, how can I plan around that so that I can still get the vaccine and have that protection? Because the alternative with getting COVID is much, much worse.
And I was thrilled. The side effects do not come from the vaccine. The vaccine's long gone. The side effects that most people are getting Are your immune system doing all the stuff it can do? It can cause fevers, it can inflame your muscles, it does all these things. So I know that my immune system revved up quite substantially when it got that vaccine because I felt it. So, it's not great, but it's also really reassuring. It doesn't matter if you don't have a reaction, though, you're just lucky.
And I tell people, that the reaction was very minor compared to the patients I talked to. You know, I talked to some patients, oh, I don't remember. I was in the hospital 21 days. I don't remember exactly what happened. So it's like, I'd rather have a sore arm than not being able to remember anything for the last 21 days or however long. Some people it's even longer than that. So, I've had 2 kids. So, a sore arm is okay.
I thought I was being smart, and I chose to get vaccinated in my non-dominant arm, and then I forgot that that's the side I sleep on. So choose wisely.
And that's what I did. I did the same thing. And, then, I was mad because I had to sleep like this. And it was like, well, it could be worse. So, yeah.
Well, let's talk a little bit about the post-vaccine. So there are a lot of conversations about opening back up and what that means, and then there's also a side conversation happening about the COVID vaccine card going on the black market, so people can prove that they have gotten a vaccine when they have not, and how that's affecting air travel and all these other things, and even possibly churches opening back up. So is it true that once you get your card that you need to carry it with you at all times? And then what are you seeing out there as far as how larger corporations, organizations are planning to utilize the vaccine card? Is it going to be something like all children must be vaccinated? That's a crazy conversation that we have, especially here in California, around vaccine hesitancy in general, but making it mandatory for even attending school.
We make all the other vaccines mandatory, so I don't know why this would be any different. It's certainly right up there with measles or anything else. We want the kids not to spread around school. There are already some schools that are declaring that that's what they're going to do in the fall. Those are mostly private schools and colleges, but it doesn't seem unreasonable. The same with travel. We already have vaccines that many countries want you to have before you travel. This is certainly as bad as yellow fever or some of the other things they want to prevent. I don't know why they wouldn't require it like they do everything else. It's not unusual to require a vaccine. That's actually a reasonable standard when a vaccine is available for a disease. So I would expect it to be like every other vaccine and be required in some places. What businesses will do, I don't know. But I will say that if you have your card, Staples will laminate it for free. You might want to go ahead and do that. I don't know that I would carry it with me because it's not as if a police officer needs it and you're just going to lose it. So put it somewhere where you'll need it. When you need it, it'll be probably in official circumstances where you're going to need it. So protect it. It's important. But at the same time, there should be some record that you got your shot somewhere where you got your shot. And they're being reported up to the state so that we can make sure that everybody got their second shot and that we're tracking it properly. So I wouldn't carry it. Get it laminated if you can. They're doing it for free. I think Office Depot also, Staples and Office Depot. But we don't know, but you can look at every other vaccine we have and just figure it'll probably be like that.
Yeah, there's definitely talk about like a vaccine passport. Sporting events are talking about, should we require vaccinations before people come into the stadium? Those conversations are happening. I think folks are going to do what they're kind of private companies, right? They're going to do what they think is they're going to be feeling comfortable with. It is good to, as Ayana say, keep yours. And there's going to be a black market for them, right? There's a black market for driver's licenses and all kinds and passports. That's going to happen, and we're not always going to be able to prevent that. But keeping your stuff safe. And I see a lot of people like posting selfies and they don't cover their name, or you'll notice that the vaccine has numbers. They'll have numbers next to your vaccine, like that stuff. You want to make sure remains confidential, because that's how people are also replicating those kinds of things and creating those things on the black market.
Yes. And then once you have the vaccine, I think you kind of covered this, but I just want to make sure I'm getting the questions answered. If I'm immunosuppressed, do I still need to wear my mask?
What was that end? I didn't hear it.
Oh, if I'm immunosuppressed, once I get the vaccine, should I wear a mask?
So people who are at higher risk, if they are around unvaccinated people, I would say they likely should. The CDC guidelines are changing as new studies come in. You'll notice on Friday that they said, everybody go ahead, don't travel if you don't have to, but if you have to, it's fine when you're unvaccinated not to quarantine. That's based on new information. I would look, but for the most part, if you're high risk, you should act like it's flu season or any other season when there is a widespread virus that you don't want to get, and that is be extra cautious and wear your mask. If you're in your household and everyone is vaccinated and a vaccinated friend comes to visit, they should probably have their mask on, not the other way around. But I would be as cautious as your condition and your doctor say you should be. There's various, a little immunosuppressed versus very immunosuppressed. So the precautions will be different for different people, but I would assume you should keep your mask on unless told otherwise.
And then if everybody in, say, a medium-sized gathering is vaccinated, the same is true?
We're trying not to have medium-sized gatherings, even if you're vaccinated. We're not there yet. We do have several California variants, so let's calm down. But if you're with another family, and that's one household, but there are 10 of them, if you're in a medium-sized gathering that fits the definition of one household, then people can be unmasked. You can be unmasked together unless there is a high-risk person in that family, like unless there's an elderly person or somebody who's frail, and then you should be more cautious.
All right. So I'm going to offer one last time before we wrap, if anybody has any burning questions to pop them on in. But I think this is time that we can wrap up. So what are the big takeaways that you would like for everybody to have? And we'll start with Dr. Margarita.
Hopefully you've gotten all of your questions answered. If you still have more, please continue to ask. I can probably speak for everyone on this panel is that we're open to answering questions as time goes on. As Ayana mentioned, as we learn more, things might change. Those things changing doesn't mean that somehow we didn't know what we were talking about before. It's just that we have new information. And so things are going to change, but that doesn't change the fact that the vaccine is safe. That's really the way that we're going to help our communities to keep the spread of COVID-19 from happening, particularly in BIPOC communities where it's disproportionately impacting. And as you've heard, you have some decisions to make, weigh that out, get trusted information. But I think you'll find that the vaccine is worth taking.
Dr. Ayana?
The vaccines are safe and effective. Many, many, many people have gotten them, and we have not seen problems in those people. So feel reassured by your many, many neighbors who have gotten it. You probably know somebody who has, so talk to them. Get the kind of information that matters for you. If you want studies, go on the websites and click around. If you need a family member or somebody you trust, ask around. They're there. Somebody got it. I did a webinar for 30 people in my family over the weekend. So somebody or somebody knows somebody. Get what you need. It's out there. And if you choose to wait, it's never too late. If you don't get it for a month, get it in a month. But that means that between now and then, you can't also be freely walking around without a mask and going to parties. So you either need to do one or the other. If you want to wait, you wait in a high level of caution, right? Because you consider yourself still at risk. So everybody else may be doing stuff. Those people aren't you. They're vaccinated, you're not. So you got to act like you're not vaccinated if that's what you choose to be, which means you've committed to being as cautious as possible and not spreading it around the community because we don't need any more.
Thank you. And Bernadette, and also Bernadette, as you close, could you also tell us a little bit about how maybe things for you shifted, like in your demeanor and your thinking before you had the shot and working in the hospital setting, and now that you have it, has anything shifted for you?
I think talking to the patients and hearing their stories, the patients who survived COVID and are currently living with the after effects, that kind of even made me more of a voice and encourage people to get the vaccine. Is it, we all know somebody's cousin's cousin who got it, or such and such cousin's cousin who died, or somebody's grandmama who had it. And, I talk to patients probably every other day who have had severe hospitalizations from COVID. And I just, I get vaccinated. I mean, it's no different than the vaccines that we grew up taking and having to get and show your little yellow card to get in school. I mean, it's, yes, Black folks have kind of gotten their share of stuff in the medical field, and that, it's still happening, but we're working through it. And get vaccinated. Get vaccinated. I mean, I don't know how else to say it. Go get your shot. You got your shot. That's a conversation for me. Oh, you don't have a mask on? Did you get a shot? Oh, you didn't get the shot. You don't have a mask on. Oh, you've already had the COVID? Just get vaccinated, people. That's all I can say. Please get vaccinated. If you need help, if you don't have the means to wait on the phone, you don't know where to go. Someone knows where to go to get it. Someone knows. Where'd you get your shot? Ask questions. If you don't believe the doctors that don't look like you, go find a doctor that looks like you. They'll tell you. Get vaccinated, people. I'm done on my tangent.
And you bring up an important thing. True or false? If I've already had COVID, I can't get it again.
I wish we knew that for sure. I wish we did, but we don't. And so you can't count on it. We don't have that knowledge. And there are illnesses where immunity is not persistent. We know that. So don't, be cautious.
Thank you. Thank you all very much for this super informative program. Before we sign off, I would like to also thank Sarah Paredes, who is a member of the GLIDE Racial Justice team, who coordinated and put this together, as well as our tech, Perry and Brent, and then also Minister Marvin for supporting the GLIDE Racial Justice Group and doing this in partnership with GLIDE. We want to remind you all to wash your hands, wear your mask, do your research, and please go get the shot. I'm Paula Farmer, and this is GLIDE Racial Justice Group, and we thank you for joining us this evening. Take care.